Welcome to your internal medicine clerkship. Now this clerkship comes with 3 guarantees. You're going to be a good reporter. You're going to interview and do physical exams on real patients, review the data, and present all that information orally and in writing so that you sound like a real physician. It's going to help you on your other clerkships and down the road whatever specialty you go into. We're going to push you to be an interpreter, come up with assessments, differential diagnoses, and if you're good and you really demonstrate ownership, we'll let you manage and educate our patients with us. The next thing is licensing exams. You should be more confident when you take this exam because we give you context for the science and we deliberately review it during the 15 weeks. And not to be underestimated, you're going to be happy. Tired a lot of days, but happy because you've directly contributed to the care of patients, you've learned something, and you've improved with feedback. Now this 10-week experience could be 5 weeks of clinic and then 5 weeks of wards, or you could do wards first, or it might be 10 weeks of all inpatient wards with or without inpatient consult experience, wherever the best patients are for you at your medical center. During the week, there's a lot of protected educational time. Twice a week, you have a preceptor session where you and a couple other students with a specially selected faculty get together to practice your presentations, evaluate patients at the bedside, review cases, and educate each other. Another big thing is the write-up, and it's always due the end of the week on Sunday. You only get 6 of these over the 10 weeks, but basically you pick the patient, you pick your actual electronic medical record note, and then use the reflective worksheet to see if and how it could improve. And then you get better with feedback from your preceptor. This is proven to improve your patient reporting and your clinical skills. Remember to upload every assignment you do into Sakai and email it to your preceptor so you can get feedback. Now week 9, your written assignment is going to be different. A brief reflection on a good or bad episode of professionalism or leadership that you saw in the hospital. And we're going to give you, or you can select, various artwork to help you with that reflection. Now what does ambulatory rotation look like? Well, first you're going to be working one-on-one with a physician, and everyone's schedule is a little different, but as an example, let's say it's going to be the same cardiologist every Monday morning, endocrinology clinic Wednesday afternoon, and then gastroenterology or GI Thursday mornings. Each of 3 half-days per week you're going to be working with a different general internist, and that gives you 2 half-days that are unscheduled to review patient records, catch up on your notes, documentation, or other assignments. For each half-day of clinic, we want you to see about 2 patients, which means you'll have about 2 hours of homework for each half-day of clinic because you have to review patient charts in advance, write your clinic encounter note, follow up your patients after clinic, and then read a review article or other brief assignment from each physician. On the inpatient wards, you're going to work on a team with 1 or more other students, interns, a resident who supervises you, and an attending physician who's responsible for the overall care of the patients. You'll get in early to round on your patients 6 days a week, attend a case conference, and then use the rest of the time to participate in procedures, interact with consultants, and do your chart documentation. You should have 1 to 3 patients at any one time, and you'll get new patients whenever your team is on call, once or twice per week. Most of your grade is based on your clinical performance, as it should be, and we use the simplest, fairest, most widely published grading around. If you can consistently do good histories and physicals and get everything out of the electronic medical record and present that in an organized, succinct way, both verbally and in writing, which is a high bar, then you're meeting that required reporter standard. If you're offering reasonable, if not right, 3-item differential diagnoses and assessments, at least half the time, then you're in that interpreter range. And if you're really offering plans and owning that patient care and educating yourself, your patient, and your team, then you fall into this top block, manager-educator area. Week 10, you're going to have the NBME shelf exam. That's 20% of your grade. You have to get a 59 or above to pass, but there's no minimum performance required to get honors overall in the clerkship. And then finally, for 10% of your grade, there's a faculty-derived multi-step exam. It's open book. We show you some videos, and then you write down elements of the history or physical exam, or a problem list, or a plan. So that's really a clinical test as well, and you'll be really prepared for that by clerkship's end. This is a lot of information. We'll go over it again at orientation. Don't worry about it. And don't lose track of the big picture. You've worked hard over the past 18 months, and you've earned the right to be here. but you can't be a bystander on the internal medicine clerkship. You're expected to give your opinions. You're going to be directly caring for patients, seeing a lot, doing a lot, all under the supervision of physicians who are carefully selected and keenly interested in you doing well. We'll see you soon.